Welcome to Public Forum, a community outreach program produced at North Idaho College on the shores of Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guest.
We're continuing this week what we started last week in our 2-week series titled Covering the Uninsured, Healthcare for All. And we have back our same 3 guests from last week. We're very pleased they could be with us. First of all, I welcome Karen Cotton, who is the program manager of the North Idaho Partners in Care. And as I said last week, Karen, thank you for being instrumental in helping us get this program together.
Thank you, Tony.
We look forward to the interview again today. I also welcome back Kelly Richards, who is MBA, or holds an MBA degree, and is with the grant titled Covering Kids and Families in Idaho. Thank you for returning.
Thank you.
And also Dr. Justin Stormo Gibson, a medical doctor in our community with the North Idaho Eye Institute. Again, thank you for taking this time. All of you are gracious to give us so much time. And with that, we shall turn to Janelle Burke to continue today's questioning from last week.
Last week we talked a lot about the problem of the uninsured, and my first round of questions is going to be for all 3 of you. We'll start with Karen, but can you recap for our viewers a little bit just what the problem is? And Karen, you had some very powerful statistics last week. Let's start with those.
This is a very big critical issue for families all across the United States, families and individuals. There are 41 million people in the United States without health insurance. Of that number, more than 8 million are children. So it's a big issue. It's growing. More than 40% of the people are afraid that they're going to lose their health insurance.
And you talked a little bit about people who are already in families who are working, that it's not just unemployed families that are without health.
We know that 8 out of 10 people come from families with at least one working person. So this is an issue that touches all of us.
And Kelly, how about children?
I work for Covering Kids and Families, which is a national initiative to basically assure that all low-income children have health insurance, have access to health care so they can live healthier and learn better.
How many children are there out there?
Well, nationally there's about 8 million children, and the numbers just vary on different states.
Dr. Stormo Gibson, what are some of the problems from the perspective of the physician?
I think it's a problem of access to health care, and to be able to treat those problems at an early stage when people are able to be treated more quickly and at less cost with a better outcome than people who delay their care and wait until it's at a critical stage.
I'm going to move into some areas that we had the opportunity to talk about between the shows. It's getting more difficult for some individuals to find physician care or dental care, whatever. And this is not a criticism of those in the field, but 1, there's only so many physicians, and 2, you can only take so many patients, and 3, you have to have a certain amount of funds to keep your operations open. But Doctor, I'll start with you on this. We know in our own area here that Medicaid patients are finding it more difficult to get the attention. Is that part of this whole question? You talked earlier about bringing all the different interests together to try to find a solution, and is that going to continue to grow if we don't solve this problem?
It will. I think our society has to realize that there's no free lunch. If we want high quality medical care and believe that everyone should have access to that medical care, then we have to figure out a way to provide that access, whether through a governmental sponsored health insurance or through private or through some combination whereby people can maybe be covered for the most efficacious treatments and the ones that are most common on a widespread basis, and maybe on the more elective types of procedures on a different private basis. Some compromise needs to be made where we can find access for everybody to quality medical care in this country.
Karen, I'll come back to you too, because this came to our mind while we were pausing from the show last week, that this is even a thing to take in consideration for senior citizens also, and Medicare patients sometimes obviously require lots of attention. As one gets older, there's more illnesses. Should that be a factor taken into consideration if one at retirement wishes to move somewhere else? Is it hard to get physicians or dental care or whatever it may be if you don't have certain insurance, or even if you're covered by Medicare, a secondary insurance that you may or may not have.
That's right, and it's important. That's something I think that seniors don't look at when they're thinking of retaring and moving to a beautiful area like we have up here. We don't have a lot of doctors that are accepting new Medicare patients. Idaho is one of the lowest states in the nation for the number of physicians per population. So we don't even have enough doctors to go around, let alone having all the people moving into our area who need care.
And I guess, Kelly, it's a little bit less of a problem for children than the other groups that we've been talking about.
It's a little less of a problem for children because children basically are healthy. They're a healthy population of individuals. So we do have doctors that take new children who are under the CHIP program or under a Medicaid program. We have a lot of difficulty with dentists. There's not a lot of room for new Medicaid patients with dentists. So we really try to emphasize some of the other things that this type of program can do for children. They can still get immunizations and eyeglasses and things that can really improve their health.
Janelle Burke.
I want to move into some solutions for these problems. Dr. Stovall Gibson actually started us on this solution process by saying we need to all sit down and talk, get all the parties to the table. But let's talk now about some specifics. Karen, do you have some suggestions for us?
I think one of the things is our communities can solve the issues themselves when we are given the resources to come to our community. The grant that I work under is called a Community Access Program grant. We have received this for 2 years. Well over $1.5 million has come to North Idaho to help us look at our own solutions here. And through that, we have been able to develop, we have free clinics in every county. We have a new one opening up in Sandpoint here within the next few months. That's not a great solution, but it is something for people to be able to have that. We also, very excitingly, opened up the Boundary Regional Community Health Center in Bonners Ferry. Little Bonners Ferry opened up a federally funded community health center. That is a full-time practice with physicians, nurses, mental health providers, dental services. They can treat everybody. Nobody can be turned away. People pay on a sliding fee scale. We're also trying to get that up and running here in Coeur d'Alene to serve the area here. So we do have some options. Also, our grant is getting one of the grants helped fund some computers, big computer issues within the hospitals. Patients transfer around. We have small hospitals, we have larger hospitals. And the hospitals need to be able to share information quickly to save money so they don't have to repeat tests. So we were able, out of our grant, to improve the computer access within our hospitals. And that's important.
Kelly, what about some of the services that you see as solutions to these problems?
Well, specific to the CHIP program, in our state, a family of four can make $27,600 a year and still qualify for the children's health insurance. And what that means is those numbers are based on percentages of a federal number. And some of the things we are looking at, possibly increasing those numbers so people can earn more. People who are working can earn more and still be eligible for that program. There are some other things that could be done to increase access to that program. There is an asset limit, so people can only have a certain number of assets before they are disqualified for the program, and a lot of states have been successful in either increasing that limit or eliminating that.
What is a number that people can call if they're interested in finding out if they could qualify for the CHIP program?
Thank you. We encourage people to call 1-877-KIDS-NOW, and that is a toll-free number. It's a national hotline, and that hotline will automatically get you to the state that you live in.
Now, if you want to be part of the CHIP program, do you have to pay a certain amount? Is there a limited amount that you have to pay in order to insure your children?
In our state, we have a free healthcare. CHIP is a free healthcare program. On the national level, states vary with the CHIP program. It is a state children's health insurance program, so each state varies, and some do have a low-cost option where people can earn even more and pay a little bit towards that.
Dr. Stovall Gibson, one of the things we've talked about is the fact that perhaps if more physicians were available, people might have better access to them. What can be done to encourage people to locate in perhaps, say, rural areas, for example?
That's a good question. I mean, the factors that affect a physician's decision to move to an area is pretty much the same as everyone else. You know, are there jobs available? Is there reimbursement that's reasonable and available in a community? Is it a healthy lifestyle? Is it a place that you want to raise your kids? I mean, there are many factors about North Idaho that attract physicians, teachers, other people to come and live here, even if the reimbursements here may be lower than other parts of the country. And so those are complex issues, and for each person, they're different. I know I came here because of the lifestyle in North Idaho, and I didn't really take into account whether or not we were going to have reimbursements, et cetera, at any particular level. But for some people, that's an important consideration. I know there's certainly lots of patients that need to be seen in North Idaho, so it's not for lack of work to do. But as you know, nationwide, there's a Medicare crisis, there's a Medicaid crisis, and what those reimbursements are going to be in the future will affect the number of people that go into medicine. And it's not a short-term, year-to-year problem. It's more of a long-term, over the next decade or two, how that's going to affect access to health care.
So you're basically saying that if medicine is not an attractive kind of career, that people may not choose to do that if there are too many problems with the entire program.
There are a lot of physicians, especially primary care doctors, who find that the reimbursement levels by Medicare or Medicaid don't even cover the costs of running their practice, don't cover the cost of seeing those patients. And so that's why more and more physicians are actually declining new patients that have those health insurance coverages. That's a huge issue that we need to work with as a nation to try to figure out as a society how we're going to
And that would include the people without any insurance too.
That, for them, it's even worse, yeah.
For our viewers who may need to get a pad and a pen, I will give this telephone number again soon so that you could call it if you need to. It was given once, but we'll wait a few minutes and give it again. Dr. Storm Gibson, I wanted to get into a little more detail about who are all the people that should be at the table that Janelle talked about. And I know that Congress is, members of Congress have introduced different kinds of plans. With your expertise and working in the field, first of all, identify all the groups that should be involved on this proposed solution. And then, although you've talked a little bit about it, would you like to identify some of those proposals that are out there?
I can try. I'm not an expert on a lot of the proposals that are out there, but there's a few that I'm familiar with that maybe we can get started with. First of all, and these groups overlap. Some of people who are in one group can often be in other groups, but certainly the patients themselves need to be represented. And uninsured patients who are insured through private insurance, who are paying higher and higher premiums all the time, and patients who are covered by government-sponsored insurance, whether it's Medicare, Medicaid, or others. The providers need to be at the table. The physicians, the nurse practitioners, the nurses, the hospitals, the people who are providing medical care to be able to explain the quality care side of it and how it costs money to be able to provide quality health care. Taxpayers, just your everyday, ordinary taxpayers, the working people of America need to be at that table to look at what is this going to cost, what are we as a society willing to pay for medical care. The insurance companies need to be there. We need to have as broad a group as possible come together and come up with some innovative solutions, maybe not the same solution for every part of the country. There may have to be different solutions for different states, but all of us need to be represented and come up with a solution rather than just fighting for our own little turf.
How about some plans that are floating out there now?
Well, I think one of the major issues that our society needs to deal with is whether there isn't enough healthcare dollars available right now to cover everybody for everything. So either we cover a certain sector of society and cover from top to bottom every medical problem and every medical treatment available, or we have to make a decision, do we want to cover everybody at some level of basic health care? So, and Oregon has a system, their Medicaid system has been, I think, innovative in the sense that they've decided they're going to cover everybody, but only to the degree that the society has decided that they're willing to pay. And so they prioritize treatments, they prioritize those treatments that are most efficacious, that work the best, that can prevent the most long-term disability, and try to treat those first. For instance, immunizations first, treating childhood diseases, etc. And the more esoteric diseases or less efficacious treatments are not covered. And somehow society has to draw that line of where those monies can be allocated.
I know in Oregon they've had very, very long and serious debates about what to cover and how much resource they'd have. One other subject before going back to Janelle, and we haven't mentioned that at all here, but it's certainly being addressed very seriously in the Congress, and it's certainly part of this whole question, and that is, even if you are able to have an excellent physician and you have some insurance and you have coverage and hospitalization, oftentimes following that, the most expensive part of your recovery has to do with medication. And so, and again, with senior citizens and Medicare, those issues come up. So I'll yield again to the doctor to talk about, should that be at the table? That's part of the package also, because if you don't have certain medications, your recovery may not be successful.
Absolutely. You see patients who come into the office and you diagnose them with a problem and give them a prescription to go get that medicine to be treated, and they can't buy it. They don't have the funds. That's frustrating, both clearly from the patient's point of view, but also from the physician's point of view. Sometimes we can scrounge and get sampled medications from time to time, but often that doesn't really cover what those patients need. And the cost of medications is incredibly high. I know a lot of my patients go out of the country, frankly, to get their medications because they can get them cheaper in other countries, even though the medications, as far as we know, are equivalent. Mm-hmm. And that has become a big issue here in North Idaho. Mm-hmm. Yeah, absolutely. Mm-hmm.
Sure. Janelle Burke.
My next question has to do with what should I be considering if I'm trying to be part of the solution and not part of the problem? What should I be considering when I'm looking at this whole entire problem? First of all, with Karen, what kinds of things should I be looking at as an adult American?
I think one of the things is taking care of yourself physically. We all know how important diet and exercise is. That's a big part of it. If we can maintain our health, if we're healthy now or reasonably healthy, and we can maintain that, that's going to go a long ways in helping us with our own health. And that's a key factor. The other, I think, is the preventative care. Getting a lot of those early tests, those yearly exams that we hear we all need. That's important, because if we can be detected early, we can treat those quickly and a lot cheaper.
And Kelly, as a person who's interested in children first, what kinds of things would you suggest as a solution? What should I be looking at? What should I be interested in and promoting?
Preventative care is definitely a big important thing for kids. If the kids are healthy, they're going to be in school, first of all. They're not going to be staying home, and learning better and being more attentive. And if they're feeling good, if they've had rested well, with asthma, we talk about kids who maybe have been up half the night. If they're getting the care that they need, they're able to participate in school and learn better and become more productive adults.
And we should be promoting programs like CHIP that will help to do that?
Yes. Children are eligible under the age of 19 for this children's health insurance program. And when they are enrolled in children's health insurance, they are eligible for free immunizations, free eyeglasses, free checkups, free dental care, free mental health services if needed, behavioral services, rehabilitative services, things like that.
So you're including in the program some of those perhaps psychological services that are needed for children with problems.
Yeah, in fact, we have there's a story that I like to tell of a local family who did not have insurance. Two small business owners working from their house didn't have insurance, and within being accepted on the children on CHIP, within that same year, the teenage daughter tore a ligament and had to have surgery and some rehabilitative services, and also the son had a tonsillectomy. And these are things that they would have been paying out of pocket for, and it really could have been devastating to that family.
For their business and for themselves as well.
Absolutely. That's where the bankruptcy issue comes in.
And Dr. Stromer Gibson, what about myself as a patient, or a person like me as a patient? What kinds of things should I be looking for to be part of the solution and not part of the problem?
Well, I think, again, trying to be seen early and trying to be treated on an early basis is helpful in terms of preventing long-term disabilities. I think, though, as a taxpayer, as a group, as an Idaho taxpayer, I think it's important for us to not be penny wise and pound foolish. Each of us who pay taxes here in Idaho already send 80 cents on the dollar out of our federal income taxes to the federal government. Those dollars are sitting in Washington waiting to come back to Idaho for this CHIP program if we'll just reinvest another 20 cents on the dollar. So for Idaho, we really haven't prioritized and maximized our investment in the CHIP program. Other states have. They go up to 250%, for instance, of the poverty level, whereas we're at 150. So that money that we're saving, that penny wise side, that we're saving that 20 cents, we're actually rejecting that 80 cents that's already come out of our pocket and is sitting in Washington. So I think from an Idaho taxpayer point of view, we need to look at our priorities and look at the fact that those monies are out there waiting for us to invest in our kids, in their health care. And the cost shifting issue that we talked about last week was that we're not really saving that money, because those indigent patients, those patients who can't pay for their health care, we're paying for it through higher insurance premiums, private insurance premiums, through indigent care funds, which come out of our property and state taxes. So we're really being penny wise and pound foolish with regard to the CHIP program.
Thank you.
I promised our viewers that I would give the telephone number again, Kelly, and it is 1-877-KIDS-NOW.
Yes, it is. And a good indicator that we like to say, for a family of 4, you can earn up to $27,600 a year and be eligible for this program.
But when you call this number and get to your state, you'll get all the other information you need.
Yes, they walk you through the application process.
But you do also have, in addition to that, a sliding scale. I think you've indicated that.
If there are more members in the family, those
Right.
income levels go up, and if there are fewer than 4, they go down a little bit.
But still, that's still very helpful economically, because they only pay a
Absolutely.
portion based on what their income is. I'm going to open a can of worms and get into controversial area as we deal with this problem that Dr. Storm Gibson has talked about. And Karen, you and I had a little discussion about this. Some places where insurance is provided to a large number of employees, they're looking at maybe everyone doesn't pay the same premiums. And I know that's controversial. And so I've heard of a plan where if you're very healthy and you have a record of good health, you don't pay quite as high premiums as people that work there that have illnesses. But I guess the reaction to that is, does that defeat the purpose of insurance? That is that we say to you, you have low premiums, but if you get sick, watch out. You don't get that. And then another comment, and get any of your reaction, that is, some lifestyles are much more leading to very expensive medical intervention. And I will give as an example smoking, and I'm sure that some people heard that message, but should those kind of things be considered in part of this solution? And I'll start here with you, Dr. Strom Gibson.
I think that's something that certainly needs to be looked at. I think, for instance, the tobacco funds that came to states.
Right.
Unfortunately, a lot of those funds, which should have, in my opinion, been earmarked for medical care due to smoking, ended up just rolling over into the general fund for a lot of states. And so I think that if you're going to tax those kinds of products, either cigarettes or alcohol, or I've heard even people talk about a fat tax for people who are eating fatty products that lead to heart disease and hypertension.
Putting more of a tax on those products?
Right. But I would only think that would be reasonable if those monies were allocated for health care.
I just hope they don't include potato chips on that list. They wouldn't be on that list. Karen, I'll get your reaction to this also.
Well, I think, again, we need to really be aware that this may be a movement like you talked about, that insurance companies and businesses are going to begin looking at their employees. Many employers now are developing healthy directions or healthy programs, encouraging their workforce.
Exercise centers at their workplace.
Exercise, encouraging them to stop smoking, or talking their insurance companies into providing for the patch, if that helps. Recognizing that their health care costs are going up directly related to lifestyle. And I think that we all have to be very careful about that and recognize that that may come down the road.
And Kelly, your reaction to that?
Well, as we talk about who needs to be at the table, one of the things, obviously the businesses also, it's an
Sure.
economic issue. This is the third year in a row we've seen double-digit increases in insurance premiums.
Mm-hmm.
And like everybody has said, at some point, some of the businesses are going to look at different ways of covering people, if not eliminating some of that coverage.
Mm-hmm. Ours have indicated some businesses, if with economic decline and recession and more unemployed people and lower revenue in state governments and national government, that it also could even mean a question of survival of some small businesses. So that becomes an important
Absolutely.
question. Janelle?
A part of the insurers program is probably going to be something about education, because that's one of the ways that we can enter into preventive medicine, and also risk management, if you will, is just that there are certain things that we should do and certain things that we shouldn't do. Can you think of some things, Dr. Stormo Gibson, from a point of view of the physician, that would enter into that solution package, that solution education package?
In about 30 seconds.
Well, education is clearly important, and anything that can be done to improve patient education. In the clinic, we're pretty much one-on-one trying to educate our patients. But I think anything that can prevent patients from getting to the point where they're in the clinic talking to their doctor about their hypertension or whatever is even more valuable. The earlier, the better.
On that note, we have to bring the program conclusion. On behalf of Janelle Burke and our staff, we thank all three of you very much for the 2 weeks you've been with us and dealing with a very, very significant, important subject that affects all people within our country. And again, I know that you have many other things to do, but you've certainly enlightened our viewers, and we are very grateful to you for doing that. Ladies and gentlemen, we believe that this has been helpful, and that was our desire to do so in dealing with the topic covering the uninsured, health care for all. I would invite you to be with us again next week when we'll shift to yet another issue. The part of this program is to bring a great variety of topics to you, and we believe that's why you keep viewing. And until then, please have a good week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running in-house college production on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us at this same time next week for another edition of Public Forum on this public television station.